Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Aishah binti Muhammad Yahaya Khan. My metric number is 1171044. I'm from class KAB, TAB4. Okay, for today, I would like to present my proposal, which is Internet usage on mental health among youth. I'll prepare this presentation for Dr. Abdul Rashid bin Abdul Aziz. Okay, for chapter 1, which is introduction. In introduction, it's included research background, problem statement, research question, objective, hypothesis, significance of the study, scope and limitation of the study, theoretical framework, and definition of concept. Okay, in the research background, in this era of globalization, Internet is a huge medium to connect people across the world without any borders or restriction. Internet has becoming one of the primary necessities towards people's lives as it parallels with the modern lifestyle that people have been implemented in their life nowadays. The problematic behaviors related to Internet use are often described in psychiatric terminology such as addiction. According to research by Dalbudak in 2013, a loss of control over one's Internet usage can have a negative impact on daily functioning, relationships, and emotional stability. For the problem statement, according to the research by GlobalStat, 72% of the social media users in Malaysia are addicted or an excessive user. More than 60% of youth from age 18 until 25 years old are using more than 5 hours a day to surfing the internet, especially on the entertainment. The addiction has caused them to have psychological implications that can affect their self-impulse control. In Malaysia, there are no precautionary or awareness program that has been done by government in order to overcome internet addiction problem for young people. There are limited research that were focusing on relationship between internet usage on mental health among youth in Malaysia. For the research question, what is the level of internet usage among youth? What is the level of mental health among youth? And what is the relationship between internet usage on mental health among youth? For the research objective is to find out the level of internet usage among youth, to find out the level of mental health among youth, to study the relationship between internet usage and mental health among youth. And for the hypothesis is, there is no relationship between internet usage and mental health among youth. For the significance of study, the significance of the study is for the body of the knowledge on counseling field. The finding from this study can help the counselors to relate the internet usage and the level of mental health of a person. The significance of the study also can be useful for a counselor and teachers at school to overcome the internet addiction among students. The data from the study also can be used by Ministry of Education Malaysia to educate Malaysian people more about the internet addiction and organize some prevention and intervention program in school and university. Okay, for the scope and limitation of study, this study is focused on the relationship between internet usage and mental health among youth. The degree student in the Faculty of Leadership and Management in University Science Islam Malaysia USIM will be involved in data collection for this study. For the theoretical framework, this study is a correlational study involving degree students in university. In this study, descriptive analysis was used to thoroughly measure the level of internet usage on degree students and the level of their mental health. It is also will be used to identify the relationship between internet usage and mental health among youth. For the definition of concept, for the internet usage, according to UNIS, in 2016 defines that excessive internet use as internet use that has become excessive, uncontrolled, and time-consuming to the point of timelessness and severely disrupting people's lives. Internet addiction disorder, IAD, is generally defined as an uncontrollable desire to use the internet leading to acute nervousness and aggression in the event of deprivation and progressive deterioration of social life. Okay, for the mental health concept, according to WHO's definition of health as contained in its constitution, which is health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Mental health is a complex construct that concerns optimal experience and functioning. Current research on mental health has been derived from two general perspectives, which is the hedonic approach and multi-level approach. Okay, for the chapter 2, which is literature review, it includes literature review, theory, and Islamic perspectives. Okay, for the literature review in internet usage, according to Brenner, 1997 asserts that while the internet undoubtedly possesses various benefits, increased usage also encompasses the possibility of misuse and/or enhances the likelihood of cultivating an addiction. For the mental health among youth, mental illness is highly prevalent in adolescents and young adults. However, individuals in this demographic group are among the least likely to seek help for such illnesses. And for the relationship between internet usage and mental health among youth, the study that was conducted by Timur in 2016 was explained that the relationship between internet addiction and psychopathology, and concluded that the greater the increase in symptoms associated with anxiety and depression. Okay, for the theory, cognition plays a role in developing and continuation of pathological internet use. Cognitive disorders, broken cycle and reinforcement creates and enhances symptoms of pathological internet use and problematic behaviors related to spending too much time on internet. Cognitive behavioral model of pathological internet use separate pathological use into categories as selective pathological internet use and general pathological internet use. In cognitive behavioral therapy, CBT has been suggested in treating internet addiction, as this modality has been shown to be an effective treatment for similar impulse control disorders. Okay, for the Islamic perspective, for the internet usage, in Islam, using the internet has been encouraged as it can be a medium of seeking and sharing the knowledge. By the first revelation, Allah Subhanahu wa Ta'ala commanded to read in Surah Al-Alaq. In Islam itself, it encouraging all the Muslims to attain the knowledge by read and understanding the meaning. Muslims should be aware that not everything in the internet is correct and authentic. Islam asks its believers to be beware of the fake content, especially regarding Al-Quran and Hadith. For the mental health among youth, in Islam there are multiple practices are available as coping mechanism against everyday stresses and hardships to relieve anxiety and other negative mental states. Foremost among them in Islam are ablution, prayer, reciting Quran, remembering Allah, supplication or invocation, asking God's forgiveness, and fasting at Ramadan or at any other days, among others. The Islamic directive provides a clear way for leading a meaningful psychosocial life and enjoying a healthy mental state. Okay, in the chapter 3, which is methodology, it's included research design, location, sampling, population, permission, instrument, data collection and procedure, and data analysis. In research design, researcher will be used correlational quantitative method. The data were collected by using two instruments which are Internet Addiction Test, IAT, and Depression Anxiety Stress Scale, which is DAS-21. The first instrument is used to measure the level of internet usage among youth, and the second instrument is to measure the level of mental health among youth. Okay, for the location of the research has been selected by the researcher in USIM at Nilai Negeri Sembilan. At the university, researcher decided to distribute the questionnaires in the Faculty of Leadership and Management, which is FKP. Researcher also focused on the degree students as sample for the study because the population itself coincides with the purpose of the study, which is among youth. Okay, for the sampling and population. For the population, it will be using probability sample, which is simple random sample. There are about 200 participants will be involved in this research. The participants will come from the Student of Leadership and Management Faculty, FKP, in USIM. The instruments were distributed randomly to all the courses in FKP, which are Counseling, New Media, Akidah Islamiyah, Mass Communication, and Dakwah Management. The criterion for a participant must be FKP degree student and in the range of age of 18 until 26 years old. Okay, for the permission will be taken from the consent form that will be put together with the questionnaire. Consent form will be put in front of the demographic questions. The reason is to let the participant know that their information will be used in this research. So the participant will have to write whether they will give their consent to use their answer in the study. Each participant will have chance to give their consent or permission to let the researcher know whether they agree or not. Okay. For the instrument, researcher will be used internet addiction test and depression, anxiety, stress scale, which is task 21. Okay, for the internet addiction test, the first instrument is internet addiction test by Dr. Kimberly Young. This instrument consists of 20 items scored on a 5-point Likert scale, and a graded response for each item can be selected, which is 1, not at all, to 5, which is means always. The total score from 20 to 100 reflect a greater tendency toward addiction. Meanwhile, for average user score, which is 20 until 39, and slightly addicted to the internet score between 40 and 69, and serious addictive user score, which is 70 until 100. The questionnaire measures the effect of internet addiction towards daily routine, social life, productivity, sleeping pattern, and feeling. Okay, for the DAS 20, it's a set of 3 self-report scales designed to measure the emotional states of depression, anxiety, and stress. Each of the scales contain 7 items divided into sub-scales with similar content. Okay, for the depression scale, it assesses dysphoria, hopelessness, devaluation of self, devaluation of life, and self-deprecation. The anxiety scale assesses autonomic arousal, skeletal muscle effects, and situational anxiety. The stress scale is sensitive to level of chronic non-specific arousal. It assesses difficulty relaxing, nervous arousal, and being easily upset. Scores for depression, anxiety, and stress are calculated by summing the score for the relevant items. Okay, for the data collection and procedure, data for the study was gathered by data collection method through a questionnaire. The questionnaire consists of demographic questionnaire, internet addiction test, and depression, anxiety, stress scale. The questionnaire will be distributed randomly into classes in the FKP, and the papers will be distributed more than 200 pieces. The reason is to be prepared if anything happens, so there will be extra questions can cover it. The duration will be about 2 months and will be take place in October 2020. Okay, for the data analysis, the quantitative data collected will be evaluated using SPSS version 25. Data also will be carefully checked to ensure the consistency and accurate entry of coding and entry. The Pearson correlation coefficient R will be determined for the variables and its statistical significance. The correlation analysis will be